Hi there. Here we are with our patient Adrian. He just stopped by the office today. 1 year after a post-COVID lockdown, he did this before COVID on March 19th, and he was 23 when he came in. He's 24 today. And basically, how do we do, my friend?
That was an awesome experience. Yeah,
Yeah?
it was a great result and a painless operation.
I'd like to use your own words. You said this was life-changing?
Yeah, that is true. Yeah, it was. It was.
Well, how so?
I mean, just feeling better about myself, feeling better in the mirror, and overcoming something that has bothered me for years. So
Okay.
it was a huge, huge help in that respect.
Okay. So, one of the things we always throw around with hair transplants is the word life changing, because I went through it and it definitely changed the way I saw myself and it changed everything about what I did on a daily basis. So, when you get a young guy like this who's 23 years old, when you see his before pictures, you'll see how distraught he must have been going through this at his age. So, like for dating and sports and everything, right? You were not comfortable doing a lot of that stuff?
Yeah, absolutely. I was on the edge, about to shave it all off. Like I was really
You
about to
were
shave it off.
ready to give up.
But going this route was my saving grace. So I'm happy I did it.
Okay, and you're doing the Propecia,
Yes.
you're doing the Rogaine, you're doing your part to keep what's left, okay? And this is a one procedure result. So let me kind of just show you. So basically, this whole front did not exist. So we re-established his entire hairline the whole way across. So we built this all the way across. We did it on both sides. We went through, just, excuse me one sec, tuck your chin down for one sec. So we went through this whole area and filled this whole band the entire way across. So when you look at them from the profile, just lift your head up 1 second here. So all this has been recreated all the way through here. We took this suture line. We start from over here on these Max Harvest cases like this. See that little line right there? I don't have my pointer, but you can kind of see this little line right under the comb. Okay, I'm gonna use my finger here. Comes around like that. Comes around like that. You got to really know what you're looking for. See that? That's the suture line right there. All the way across. Through there like that. So he's got a perfect suture line. He's able to taper his hair underneath. He can shave this low like all the young patients want to do. His suture line's way up here, so there's no effect for tapering. He was solid back here in this crown, so he's doing his part with the Propecia and the Rogaine to stabilize what's here. Then he's a super easy fix because all we got to do is fix the front. He's going to need one more just to kind of tighten this up a little bit through here. So what I like to do on that second pass is just kind of go through and fine tune. I'm going to tighten the hairline up. Then I'm going to go through and thicken all this up between on the recessions on both sides. The center, as you can see now, is super solid. Doesn't need much in there, but maybe a little bit more on this side over here. So we're going to basically go through here, tighten this up, fill the front. He keeps this Propecia and Rogaine going. He's done. And then he's back in business. So I like to get the patients in early. I'm one of these doctors that is a big proponent of getting the patients in as soon as possible. And this is the reason why. Because look at him, a year later, he's back to his life. And one more procedure, you never have to worry about hair again. And he, quite frankly, he probably doesn't even need to do it. But I know he's a perfectionist, and at some point he's going to want to fine tune that. Right?
Absolutely, yeah.
So, and not to get corny and all, but so do you, how, like daily, are you walking around like all like feeling better?
Yeah, no, absolutely,
So
absolutely.
that's how it was with me. I look in the mirror and I'm like, yeah.
Yeah, it feels like a cheat code. Like, you
Right.
overcome something you thought was impossible to overcome. So
That's awesome.
it's a huge relief.
That's great. So did you have any pain, swelling, anything unusual during the healing process?
No, I would call it discomfort, maybe
Okay.
the first day, but afterwards there was no issue with
No
pain.
issue.
I don't think it's any more painful than going to the dentist. That's how I would consider it. I've had more painful experiences at my dentist,
Yeah.
so it was no issue, nothing to be afraid of.
Wow. So he's my first video post-COVID. So here we go. And what do you say to the guy sitting at home thinking about whether or not he should do this? What's your advice to that guy?
I think you can look at all the photos on the website, and that's how I got a good idea of what to expect. And I've watched all these videos on this channel too, so that was a huge help as well. And Dr. Bolton's very transparent with his work, and that's why I felt comfortable coming here.
That's awesome, man.
Okay.
That's awesome. Thank you very much
No,
for
of
doing
course.
the
Thank
video.
you.
Congratulations. I'm super happy for you. Now
Absolutely.
you get to go enjoy.
That's right.